Hello, thank you for giving us the opportunity to present on our research projects how much do comorbidities contribute to nocturia-associated quality of life in men with lower urinary tract symptoms. This is the collaborative project between the Pharmacology Department of the University of Mainz, the Medical Affairs Department at Boehringer Ingelheim, and the Urology Department at Istanbul Medipol University. Here we show the conflict of interest of all authors. As you know, nocturia is a frequent part of male LUTS and is strongly contributing to a reduced quality of life. LUTS medications typically cause little improvement of nocturia relative to placebo. A possible explanation is that the multifactorial causes of nocturia are affected in a limited way only if only one of the factors causing nocturia is modified. Other causes of nocturia include chronic heart failure, diabetes, lifestyle, and several others. Thus, our research question was, what is the contribution of heart failure and diabetes to nocturia-associated quality of life? For short, NQUAL. After our abstract had been accepted for the ICS meeting, a corresponding full paper has also been accepted and is now available as open access. All relevant details of the projects can be found in that paper. Nonetheless, I'll provide you with a short summary of the main methods. This was a for-purpose designed non-interventional study in 5,775 men with LUTS treated for 12 weeks with 0.4 milligrams once daily tamsulosin OCAS. We applied multiple linear regression analysis with NQUAL as the dependent variable. Heart failure, diabetes, and others served as independent explanatory variables. Regression analyses were performed in parallel with and without inclusion of captured number of nocturia episodes as explanatory variable. As you can see here, similar to previous other studies, a 12-week treatment with tamsulosin improved LUTS and overall quality of life to a clinically meaningful extent, as can be shown here, for the total IPSS going from about 19 to less than 10, number of nocturia episodes from almost 3 to a little over 1, increasing Qmax, slightly reducing PVR, whereas the QOL as part of the IPSS question was reduced. In contrast, the NQUAL score was increased, and so were its sleep and bother subdomains. In this score, in contrast to this one, an increase is a positive development, and the extent of these increases are deemed to be clinically meaningful. However, when we analyzed the effects of heart failure and diabetes, they had only a minor modifying effect on the improvement of both the overall QOL score of the IPSS or the NQUAL or its subdomains, as shown here for heart failure and here for diabetes. I conclude, comorbidity of heart failure or diabetes is associated with slightly smaller improvements of the NQUAL score in men with LUTS upon treatment with tamsulosin OCAS. The effect sizes of the comorbidities are only small relative to the overall observed improvement. Effects of comorbidities mathematically are partly explained by smaller reduction in nocturia episodes, but partly also independent of nocturia episodes, indicating that these comorbidities have a non-specific effect on quality of life.